If you are over 60 and experiencing morning joint stiffness, abrupt abdominal discomfort, disrupted sleep, cognitive fog, or prolonged symptoms, I require your utmost attention today. One healthy spice utilized daily by millions of seniors who believe it safeguards their health may, in certain combinations, have the contrary effect. What is the most astonishing aspect? These perilous combinations typically occur at home, namely in your kitchen, initially without any warning indicators. Have you ever used turmeric into your bedtime tea? Or combined it with items you believed were beneficial for your digestion? You may have been consuming turmeric supplements with your usual meals, believing you are benefiting your joints in memory. However, what if I informed you that consuming turmeric with inappropriate foods, particularly after the age of 60, may irritate the stomach lining, conflict with medications, exacerbate gallbladder problems, disrupt sleep, and elevate the risk of bleeding? Remain with me, as the information you are about to receive may transform your utilization of turmeric and potentially safeguard your health in unforeseen manners. Before proceeding, I wish to express this unequivocally and sincerely. If you are a newcomer, kindly subscribe to this channel. This channel is specifically designed for elders such as yourself. Weekly, we provide straightforward, candid, and pragmatic health advice, including natural treatments, medical insights, and lifestyle practices aimed at enhancing digestion, safeguarding cardiovascular health, alleviating joint discomfort, improving cognitive function, fortifying bone density, and preserving autonomy beyond the age of 60. By subscribing, you are not merely viewing films, you are providing yourself with continuous support for a healthier, more tranquil, and more self-assured life in your senior years. Now, let us discuss turmeric and the 3 meals that should never be combined with it after the age of 60. How turmeric impacts individuals over 60. Turmeric is frequently lauded as a miraculous spice. It is widely discussed on television, social media, among friends, and even by medical professionals who assert its efficacy in alleviating inflammation. Indeed, turmeric possesses genuine advantages. However, the aspect that is seldom articulated with clarity is that your body after the age of 60 differs significantly from the body you possessed at 40 or 50. As your body undergoes changes, the manner in which turmeric interacts within you also alters. With advancing age, the digestive process inherently decelerates. Food remains in the stomach for an extended duration. The muscles of the digestive tract no longer propel food forward as effectively as they previously did. Concurrently, the stomach generates diminished levels of protecting acid and mucus, resulting in increased susceptibility of the gastric lining to irritation. This alone alters the impact of potent spices such as turmeric on your body. Next, we consider the liver. Post-60, liver enzymes exhibit diminished efficacy and speed compared to their previous functionality. This is significant since the liver is tasked with metabolizing chemicals like curcumin, the active component in turmeric. When hepatic function diminishes, chemicals remain in the body for extended periods. What formerly flowed effortlessly can now accumulate, subtly exerting pressure on your system over time. The gallbladder exhibits increased sensitivity with advancing age. Turmeric enhances biosynthesis, facilitating fat digestion. This may be beneficial, but for seniors with gallstones, gallbladder inflammation, or mild digestive sensitivity, such stimulation can induce discomfort, cramps, nausea, or abrupt digestive disturbances. Numerous individuals fail to associate these symptoms with turmeric, as they presume that something natural could not be the source. Moreover, it is a fact that the majority of seniors are utilizing medications, antihypertensive medications, anti-diabetic pharmacotherapy, cholesterol-lowering medications, anticoagulants, acid suppressants. These drugs impose additional strain on the liver and digestive system. Turmeric actively influences the absorption, metabolism, and processing of many medications. Consequently, turmeric may provide relief from joint pain or stiffness, often within a matter of days. However, that same potency is precisely why turmeric can be detrimental when utilized recklessly or improperly, particularly in an older organism. It is crucial to understand that turmeric is not neutral. It does not just exist within your body. It significantly alters the efficacy of other foods, supplements, and treatments. Think of turmeric as a volume control mechanism. Regardless of the combination, turmeric frequently amplifies the effect. In the appropriate combination, that amplification can be beneficial. In an inappropriate combination, it might subliminally overburden your system. For seniors with sensitive digestion, this overload typically does not occur suddenly. It develops gradually. Increased fuel consumption compared to the norm, intermittent abdominal distension, intermittent mild abdominal pain, minor nausea following meals, difficulty sleeping due to gastrointestinal discomfort during the night. These symptoms are frequently trivialized as mere manifestations of aging, whereas they may actually represent early indicators. Have you observed that your stomach sensations have been erratic recently? On some days, one may feel well, but on others, one may experience heaviness or discomfort without an apparent cause. Have you observed an increased propensity for bruising or a prolonged duration from minor cuts to cease bleeding? Have you experienced fatigue or mental cloudiness despite consuming what you consider a nutritious diet? These may be nuanced indicators that what you trust or assume to be beneficial is in fact detrimental to your body. This does not mean that turmeric is detrimental, but it means that turmeric warrants greater respect after the age of 60. Your body has become more astute, more sensitive, and less tolerant of excess strain. That sensitivity is not a sign of weakness, it's a form of information. Remain with me as you now understand the differential impact of turmeric on seniors. It is time to discuss the first perilous food combo that millions of older folks consume daily, often unaware of the associated risks. Avoid combining turmeric with dairy products after the age of 60. This fact astonishes many individuals. Dairy milk, yogurt, dairy product derived from milk. Numerous seniors incorporate turmeric into warm milk at night, certain it helps in sleep and alleviates inflammation. However, the reality is that after the age of 60, this combination can significantly disrupt your digestive system. Dairy is dense, slow to assimilate, and promotes mucus production, especially in aged digestive systems. Conversely, turmeric enhances the production of bile and digestive enzymes. The combination of turmeric and dairy send conflicting signals to the stomach. Rather than proceeding efficiently, digestion becomes lethargic and inflamed. This results in gas, bloating, acid reflux, and disrupted sleep for numerous seniors. Some individuals may suffer chest discomfort and mistakenly attribute it to cardiac issues when it is in fact stomach distress. Remain attentive, since the next information is crucial. Turmeric may hinder calcium absorption when combined with dairy in substantial quantities or frequently. This means that you may be inadvertently compromising your bone health, which is precisely what you aim to protect after the age of 60. If you have been consuming turmeric milk at night, consider this honestly. Do you wake up feeling bloated? Do you experience chest heaviness? Do you experience restless tossing and turning rather than achieving restful sleep? Is there a more secure alternative? Turmeric, combined with warm water or a small quantity of light plant-based milk consumed earlier in the day. The timing is often underestimated. Could you have anticipated that a nightly turmeric routine may adversely affect your digestion and sleep? Please inform me in the comments section. Turmeric and foods high in oxalates, a subtle kidney hazard. This subsequent topic is little discussed, although holds significant importance for elders. Turmeric is naturally high in oxalates. Oxalates are substances that may facilitate the production of kidney stones, especially in elderly people whose renal filtration is less efficient than in their youth. Spinach, beets, almonds, cashews, and dark leafy greens are rich in oxalates. Consuming turmeric in conjunction with these foods consistently can lead to a gradual accumulation of oxalate levels in the body. The affrighting part? You won't perceive it initially. Absence of pain, no notification. Eventually, acute back pain, dysuria, or sudden renal complications may arise. This does not mean that you should entirely eliminate turmeric from your diet, but it means that one should never regularly combine turmeric with high oxalate diets after the age of 60. If you enjoy spinach salads or nut-based snacks, turmeric should be consumed on an alternate day or at a separate meal. spacing is significant. Most individuals are not aware that hydration diminishes in efficacy with advancing age. Oxalates persist in the body for an extended duration. Consequently, elderly are more susceptible. Have you ever experienced kidney stones or received advice about kidney health? This section has the potential to prevent an unpleasant surprise. Turmeric and anticoagulant foods, a hemorrhagic risk. Kindly pay close attention to this matter. Turmeric inherently acts as a blood thinner. This is one reason it is lauded for cardiovascular health. But when paired with other anticoagulant foods, particularly garlic, ginger, ginkgo, fish oil, or diets high in aspirin, it can excessively thin your blood. This may increase the risk of bruising, epistaxis, internal bleeding, and dangerous interactions with drugs like warfarin or aspirin in seniors. A significant number of seniors consume garlic on a daily basis. Timing, dosage, and the most significant errors seniors commit. A significant error elders commit with turmeric is its daily, continuous consumption without intervals. Turmeric possesses significant potency. Powerful entities demand reverence. Daily consumption of turmeric, particularly in supplement form, may irritate the gastric lining, exert strain on the liver, and interfere with iron absorption. Older adults already exhibit reduced iron absorption, and turmeric may exacerbate this condition. This may lead to fatigue, weakness, dizziness, and low energy symptoms frequently attributed to old age rather than dietary factors. What is the more secure method? Administer turmeric in cycles, biweekly to triweekly, minimal quantities, consumed with light, uncomplicated dishes rather than substantial meals. Avoid consuming turmeric on an empty stomach if you suffer from gastritis, ulcers, or acid reflux. Are you currently consuming turmeric on a daily basis? Engage in self-reflection and contemplate making adjustments following today. Safe usage of turmeric post-60, intelligent alternatives. Let us now discuss your potential actions, as this is not a matter of fear, it pertains to judicious decisions. Turmeric is most effective when consumed earlier in the day alongside light meals. It complements warm water, a dash of black pepper, and healthy fats such as olive oil, rather than dairy or substantial proteins. Utilize it for brief intervals of joint inflammation or sluggish digestion rather than as a perpetual everyday practice. Crucially, heed the signals of your body. Senior individuals exhibit heightened sensitivity rather than diminished strength. Sensitivity constitutes information. If turmeric induces sensations of heaviness, bloating, dizziness, or restlessness, it is signaling a response from your body. Would you contemplate decreasing turmeric rather than augmenting it? Numerous elders experience enhanced well-being when they engage in such activities. Let us succinctly summarize the information acquired today. Post-60, turmeric should consistently not be mixed with dairy, high oxalate meals, or certain anticoagulant foods. These combinations may insidiously impair digestion, renal function, sleep, and circulation without overt indicators. When utilized appropriately, turmeric can be beneficial. When utilized indiscriminately, it may result in complications. If this video altered your perception about turmeric, kindly like, share, and subscribe to this channel. By subscribing, you will receive weekly health counsel tailored for seniors, assisting you in safeguarding your health, mitigating concealed hazards, and confidently enjoying life after 60 with clarity and tranquility. Please share in the comments your typical method of consuming turmeric, morning, evening, or never. I would appreciate your response.